Good morning, good afternoon, good evening everyone. Saan man panig po ng daigdig kayo naroon. Welcome to our 91st episode of Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community. And to all those who have just discovered us today, welcome po. We usually refer to waves or surges of COVID-19. Somehow there are periods po where transmission increases. Meron din naman pong times where in the number of infections ay bumababa. So definitely, vaccination has contributed to our current status where we are more confident po with regards to opening up the community, returning to work, returning to school. Sa kabalang banda naman po, COVID-19 has brought with it a rising tide of psychosocial problems na hindi po talaga nagwo-wane katulad po ng infection. So may mga healthcare workers po tayo, mga kapatid sa frontline who suffer from those kinds of conditions po, and obviously those may put their family members po at risk. So they also see how the lockdowns have affected yung kanilang mga kamag-anak, mga kaibigan, pa-senior citizen po ito, kanilang mga anak, mga kaibigan ng kanilang mga batang anak at young children po. So for today's webinar, we will discussing the rising tide, mental health outcomes of the pandemic. So if you want the latest science-based and evidence-based information from a panel of distinguished experts, keep it right here. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health at University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date. Obviously, very happy po ako to share hosting duties with our adjunct research faculty at National Telehealth Center and also my mentor and the special envoy of the President for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, good afternoon, Raymond. Magandang hapon po sa inyong lahat. Great to have everyone here again. Nagpapasalamat kami na nandito kayo dahil kung hindi po sa inyo, wala po kami rito. Alam mo, Raymond, talagang sabi nga ng mga international colleagues natin that this is the second pandemic. And I think what we're seeing in the literature is that about 20% of people who develop COVID within 3 months have some kind of a mental health problem. No? Now, for frontliners, health workers, those of us who are here in this community, nandyan noon pa, simulat sa pole, yung hindi kayo makauwi sa pamilya kasi naiisip nyo baka mahawa nyo sila. O kaya nagka-COVID kayo, you get COVID yourself, and it's very stressful. Or you hear about somebody who got COVID na nakasama nyo. So there are so many reasons for health frontliners to have anxiety, no? And sometimes it becomes really debilitating, no? Hindi na makapagtrabaho, maraming nag-quit, marami nang umalis sa pag-nursing o kaya sa pagdodoktor, no? So sa araw na to, we have really very good guests. We're going to talk about how do we stem this rising tide of mental health issues and problems. Tsaka parang pag meron tayong mga pasyente, how do you know kung kailangan nyo nang i-refer? Or siguro, kung kayo mismo merong nararamdaman, lumalapit ba kayo sa iba para magpatulong? Ito yung mga tanong natin, no? So, samahan nyo kami. Maganda pong pag-uusapan natin. We will talk about mental health. I know this is one of your favorite topics. So, tuloy-tuloy lang tayo, and we're all looking forward to a great lineup of guests. So, go ahead, Raymond.
Thank you, Dr. Susie. For those who are joining us for the very first time, we usually put out interview video po na just to put our discussion into context. Ang tawag po natin dito ay person on the street video. Para sa ating person on the street video for today, ang tanong po na ating pinost sa ating interviewees, paano naapektuhan ng COVID-19 pandemic ang inyong mental health? Mayroon po ba kayong nabalitaan na nagkaroon ng problema sa pag-cope? Ano-ano ang mga pwedeng gawin para maalwanan ang inyong mga stressors? Medyo malalim po ang Tagalog. Pero please watch this.
Naapektuhan siya because of my personality, because I'm a very extrovert person. Tapos, because of pandemic, I am not able to go out and be with the people na, ano yun, cheer up sa akin, encourage sa akin. So, hindi ko sila ma-meet physically.
Hindi pa din ako adjust talaga ng tuluyan dito sa ganitong setup. Pero in terms of kung paano ako nahirapan, sa tingin ko kasi nasanay ako sa pagpapasok ako na school namin, nakikita kong ibang kaklase ko, tapos nakakapag-usap kami, tapos sabay-sabay kami nag-aaral, sabay-sabay kami kumakain.
May mga kakilala ko na struggling sila sa pandemic dahil sa sitwasyon ng mental health nila. May mga ilang na akong mga kakilala na diagnosed. Talagang ngayon wala akong connection with them dahil nagputol-ugnay sila sa amin.
I have been diagnosed with major depressive disorder since 2016. So when the pandemic hit in 2020, I was actually in a neuropsychiatric ward. When the pandemic hit and I was discharged from the neuropsychiatric ward, nothing really changed kasi yun nga, na-prepare na ako inside the ward for a life in isolation. That was what I thought.
Isa siguro na na-feel ko din sa mental health ko was when I experienced death na within the family. I saw that iba yung napapanood mo lang, iba yung nakikita mo lang na cases and mga namamatay, and iba na siya pag you experience it to your own family, like personally.
I started hurting myself in many ways. So I admit it's not a healthy way of coping, but that's what I did. I stopped taking my medications and I started isolating myself even more. So eventually problems arose. So marami na akong dinideal with na stressors and triggers, and I didn't know what to do.
Ang mga pwedeng gawin para kahit papaano ay mabawasan yung mga stressors ay siguro para sa akin ang pinaka nag-work ay yung time management talaga. Kailangan kong iset na yung mind ko kung ano yung kailangan kong gawin ngayon, pero in a way na hindi siya masyadong sunod-sunod para magkakaroon pa rin ako ng oras sa sarili ko.
I'm trying to make it normal. I'm trying to get back to my normal routine. Unlike before, I try to go out as much as possible with, syempre, safety precautions. I try to go out and like do biking or walking around.
I have a partner na diagnosed with a mental health illness. And kumbaga yung pag-unawa dun sa kalagayan niya ay isang malaking bagay para makatulong sa kanya sa kanyang pinagdadaanan at kung paano siya makaka-cope with the situation lalo na nitong pandemic.
Everything that develops mindfulness, doon talaga ako nag-focus as a method of coping. So when you adopt a healthy mindset, a mindful mindset, kumbaga, mas magkakaroon tayo mas magkikreate tayo ng better relationships.
Okay, thank you so much, TVUP. No, I'm always blown away by how you're able to get our persons on the street. But these are real, hindi naman po reenactment to, mga in-interview po ng TVUP. At alam po natin na maraming kabataan talagang meron silang mga nararamdaman, meron silang mga iniinda. And I think, what we want to do now is to understand it and to know what we can do to help. No? Kasi this is still part of COVID. Doesn't mean na dahil, nag-alert level 1 na, tapos na. Hindi, mukhang medyo tuloy-tuloy ito. No? So, tuloy-tuloy yung mental health problems. No? So, okay. So, I think coping is going to be one of the topics we're going to discuss, and how to overcome stigma. Kasi kahit na ano sabihin natin, ayaw natin yung medyo markado tayo na, nagpapatingin sa psychiatrist, no? Ganon. So, we have to talk about this openly because definitely our frontliners are very much affected and the families of our frontliners. Okay. Raymond, sabi mo 91 episodes na tayo. My
91
goodness.
episodes, Dr. Susie, yes.
I don't know. I just can't believe it. Okay, so we've done 91 episodes and we are fast approaching our second year anniversary.
That's correct.
So for our second year anniversary, we would just like to remind everyone, and we did this last year, no? Nagkaroon tayo ng COVID-19 Heroes Memorial, and I think it was a very touching moment for all of us, and I think even the second year is going to be the same. So we would like to ask you if you have friends, family who have passed away and have sacrificed their life in the service of others for COVID-19, please send us your photos and a little bit of a caption. High resolution portrait photo, at least 300 DPI. Ano ba yung DPI, Raymond? Pixel ba yun?
Something per inch. Sorry, hindi ko
Per
alam
inch,
yung
okay. DPI, oo, parang magkukunwari, hindi ko alam kung ano yun. Full name, date of birth, date of death, and what is the occupation. So we want to remember, I think we want to remember, we do not want to forget the sacrifice, the ultimate sacrifice na ginawa ng ating mga kasamahan. And this is our small way of doing it. Hoping na hindi magkaganto ulit, no? Hindi tayo magkaroon ng ganito ulit. Okay, Raymond, over to you.
Thank you, Dr. Susie. So, fast approaching na po yan, and March na po, at malapit na po ang, well, next month we'll be celebrating our 2 years na po ng ating Stop COVID Debt webinar series, and we hope to be able to get well, we are accepting po stories also, just very brief stories, if you could share that with us, but it will be a little bit more interactive in that sense po, if you'd be able to share with us photos of your kaibigan or kamag-anak po, as mentioned, as part of our COVID-19 memorial. Right now we have 800 and plus attendees in the Zoom webinar, but we can accommodate up to a maximum of 3,000 participants. So please join us in Zoom so you can fully experience this interactive program. If you are watching in YouTube and Facebook, do not fret, dahil kayo pa rin po ay makakapag-join sa ating webinar for today. Although it will be better kung sa Zoom po kayo to be able to fully experience ang ating online community. Please input into the chat box dun po sa mga nasa Zoom, at sa comment section po dun po sa YouTube at Facebook, na kung saan po kami nagla-live stream ng episode pong ito, so that we'll be able to pick out the questions from our audience. For those who are asking, we have been able to distribute all 90, well, partially na 90, no? All 89 episodes na certificates po, no? But for I think for webinar 90, we are still medyo may pahuling buhos pa po ng mga i-distribute po natin mga certificates, and only those who have watched at least 50% of the webinar duration will be receiving certificates of attendance. Those who are not in the Zoom, ito po yung pinakihintay, please open your browsers and enter www.menti.com. And then pagdating po ninyo doon, pag tinanong po kayo ng code, input po ninyo ang 41152662. That's 41152662. So you'd be able to participate in our fun poll. Today's webinar will be using the standard panel discussion format, wherein the speakers will give their talks, followed by a reaction, and then we'll be doing Q&A sessions po, wherein we'll be entertaining questions kung saan man po, Zoom, YouTube, or Facebook po. Without further ado, Dr. Susie will introduce our opening remark speaker.
Okay, bago yun, Raymond, sabi ni Renato Jose, saan ba yun? Ang ibig sabihin daw ng DPI ay dots per inch. Oh, meron tayong bagong natutunan
Okay.
ngayon.
Thank you po.
Thank you for looking that up. But when I thought about that, I said, how could you have 300 dots in 1 inch? Maliit lang yan. Parang 300 dots. Ibig sabihin, high resolution.
I think so. Yes po.
Maganda yung litrato. Thank you very much, Renato, for giving us that. No? Okay, so let's go to our opening remarks. Well, we have somebody who's very well known in the mental health community. Siya po ay director ng ating UP Diliman Psychosocial Services. She's a well-known advocate. And really, she's like a burst of sunshine. She's a life coach. She sees patients also. And she's a psychotherapist and a clinical psychologist. We'd like to welcome to the webinar Dr. Violeta Bautista. Bolet, welcome.
Hi, Dr. Susie. Why, thank you for such a warm introduction. I feel very much at home in your webinar series. No? Oh, magandang tanghali po sa ating lahat. Good noon to everyone. Nakaka-proud naman po ang sipag ng University of the Philippines and National Telehealth Center together with Philippine General Hospital in addressing pressing mental health issues resulting from the pandemic sa inyong Stop COVID Deaths webinar series. Nakikinig ako sa kwentuhan yung dalawa, Doc Raymond at saka Doc Susie. At tuntua ako na malaman that this is your 91st webinar offering and that you are soon to be moving into your second year anniversary. At syempre, dahil nasa field of psychology ako, I very much appreciate your decision to focus your special edition webinar. Ano kaya ibig sabihin ng special edition webinar? Siguro mamaya ikakwento nyo sa amin on mental health outcomes of the pandemic. Siyempre, we know that even before the pandemic,
Teka, Bolet, nag-freeze ka? Or ako lang ba yun, Raymond?
No, pareho tayo, Dr. Susie.
Okay. So, Dr. Bolet, we lost like a minute.
Okay. Narinig nyo.
We've lost you, Bolet. We've lost you again. We lost about a minute of what you said. Raymond, wala talaga, no?
Medyo napuputol. I think it's where it's based on her location. There's a delay.
Oo. Okay, Doc Bolet. Baka you can move your position muna. Move your location. We can't hear you.
Yes. Tingnan na.
Sayang ang ating...
Oo nga eh. Well, sige, let's do this, ha? Let's try to get Doc Bolet back so we can hear her message. And in the meantime, why don't we go to our fun quiz muna, Raymond?
Okay. Kasi
Bolet, nandiyan pa siya? Doc Bolet.
Dr. Bolet is still here. Pero kasi if we don't have Dr. Bolet's video, we don't really experience her full persona eh. Kasi that's the entire package eh. So,
Oo nga.
we hope to get her na may video sana.
Oo nga.
Okay.
Well, I think we have to proceed, Raymond. Let's proceed with the... And then let's just bring Bolet back once her connection is...
Okay. Sige po. So, thank you, Dr. Bautista. We'll get back to you, Mama, once your connection is a little bit improved. Kumbaga po.
Bolet, lumipat ka. Move to another place. Okay, move to another place muna. Sige. Okay, Raymond, let's go.
Okay, thank you so much. We have 2 questions for today as part of our fun quiz. And flash on the screen po ang ating dalawang katanungan. They are in Filipino. The first question reads, alin ang maaaring senyales ng depression? Option 1, walang gana sa dating kinagigiliwan. Option 2, walang gana kumain. Option 3, hindi makatulog. Option 4, walang pakiramdam. And option 5, mainit ang ulo. Uy, gumagalaw pala yung kulay sa sa may entidad.
Parang
ang
natutuwa
galing.
ako.
It's
maganda.
like a rainbow. We hope yung pong ating mga attendees, at least in Zoom, which are numbering almost 900 na po, no? Makasali po dito sa ating fun quiz. At habang sinasagutan po yan, gusto po namin batiin ang mga nagjo-join from the Bataan St. Joseph Hospital and Medical Center in Balanga, Bataan, Rogaciano Mercado Memorial Hospital in Santa Maria, Bulacan, the Department of Social Welfare and Development, Haven for the Elderly in Tanay Rizal, Eastern Visayas Regional Medical Center in Tacloban, Leyte, and Davao City Health Office in Paquibato District, Davao del Sur, and finally, Amay Pakpak Medical Center in Marawi in Lanao del Sur. For our second question naman po, alin ang maaaring senyales ng anxiety? Okay, medyo mahirap yata itagalog ang anxiety. Nevertheless, the options are as follows. Number 1, nervyos. Number 2, hindi mapakali or restless. Number 3, hindi makakonsentrate. Number 4, nakakaramdam ng panic. And number 5, natitense. Natitense po siya. So, please, feel free. And talagang we encourage you to join our fun quiz po. Lalo na po yung pong mga nasa labas po ng bansa, internationally, from Manama, Bahrain, Bandar Seri Begawan, Brunei, Bintaro, Indonesia, Bukit Mertajam in Malaysia, Bangkok, Thailand, Ho Chi Minh, Vietnam, German Embassy in Singapore, Makkah, Saudi Arabia, Lunichi Ali University of Blida II in Algeria, University of Fiji in Lautoka, Vacaville, California, Lexington, Virginia, Edmonton, Alberta, Canada, Surrey, British Columbia in Canada, and St. Eustatius Auxiliary Home Foundation in the Netherlands, Antilles. So maraming salamat po sa inyo. Hindi po namin muna ito isasara ang ating fan quiz. Alam po namin na marami pa po ang gustong sumagot sa ating fan quiz. But we will go on to Dr. Bolet. Back to Dr. Bolet po. Are you back, Ma'am Bolet?
Mukhang hindi yata makapasok si Bolet. Raymond, we'll go ahead na. Parang
Okay.
she had to go na. Okay, so we'll keep that open. You can continue to answer the questions. And actually, I really like the fun quiz, Raymond. Parang
Oh, marami po
yun
ako natutunan. It's something that
But
something that reminds me of ano ba ang tungkol dito sa webinar na ito. So
parang ano ba yung pinaka-importante, di ba? Minsan kasi
Correct.
ang dami pinag-uusapan. Okay, let's go to our main presentation. So I am very happy to introduce to you our first presenter. She is the chair of the Department of Psychiatry and Behavioral Medicine at the UP College of Medicine, Philippine General Hospital. And we're very fortunate to have her for the first time, Dr. Evangeline de la Fuente, or Dr. Sandy. Sandy, welcome to the webinar.
Hi, Dr. Susie, Dr. Raymond. Thank you for having me here. So,
Sige. Okay, go ahead, Sandy, with your presentation.
all right, sharing my screen now. Okay, so today's presentation has been entitled The Rising Tide, Mental Health Outcomes in the Pandemic. And I was instructed to prepare a pretest, and let's go over this now. So let's say you know someone named Jake who has been feeling unusually sad and downhearted for most of the day, almost every day for 2 weeks. He does not feel like eating and has lost weight. He cannot keep his mind on his work, and his work performance has dropped. He has put off making decisions and feels that even his day-to-day tasks are too much for him. To him, life seems meaningless, and he doesn't feel like he's worth much as a person. What would you recommend that Jake do? Talk with family and or friends? Talk with an advisor? Talk with a mental health professional? All of the above or nothing? It is okay to be not okay in this pandemic. The second question is, a person who has exactly the same symptoms as Jake, but that person is you. If that person were you, what would you do? And same choices. Talk with family and or friends, talk with an advisor, a mental health professional, all of the above, or nothing, because it is okay to not be okay in a pandemic. So moving along, let me walk you through the learning outcomes for the next 20 minutes. We would like to describe the toll taken by COVID-19 on mental health in general among health workers and on an individual level. And we would like to explore ways of enhancing resilience by using cognitive behavior techniques to promote emotional regulation, self-compassion, and appropriate help-seeking behavior. Okay, so we are still in a pandemic. The pandemic has taken a toll on many lives the world over. COVID-19 has taken hundreds of thousands of lives, infected millions of people, upended the global economy, and cast a shadow across our future. Much of society has been upended in unprecedented ways. The measures adopted to mitigate the public health crisis, such as travel restrictions and lockdowns, have affected physical movement and social interactions integral to the promotion and maintenance of mental health. Okay, just to give you a benchmarker on how disruptive COVID was on an individual level. A study in the US noted an average decline of from 10,000 to 4,600 steps per day. So hindi ko alam kung nakaka 10,000 steps kayo per day pre-COVID. Pero kung hindi man, surely nitong pandemic, nabawasan pa yan. For the study participants, there was an increase in sleep hours from 25 to 30 minutes per night kasi they would wake up later. Then time spent socializing declined by over half. So naging less than 30 minutes. And then yung screen time sa gadgets nagdouble. Now, the proportion of participants who became at risk for clinical depression went up by 90%. Okay? So, undoubtedly, the pandemic has been very stressful for all of us. So to review, the stress response is an adaptive response. When we are, for example, crossing the street at masasagasaan tayo, yung stress response is what saves us. Yung amygdala natin turns on stress hormones para we can fight or flee whatever the stressor is. So ito yung magpapatakbo sa'yo para hindi ka masagasaan. Okay? So ang stress response is meant to be short-term. Pero pag ikaw ay chronically stressed, nagiging chronic stress siya. Okay? At sobrang delikado ang chronic stress. Okay, it leads to high blood pressure, lowered fertility, it weakens the immune system, gives rise to heart problems, stomach problems. So of course, we don't want chronic stress. Despite our own challenges as healthcare workers during this pandemic, the nature of our profession calls upon us to keep taking care of the needs of many people who rely on our expertise and compassion for the restoration and maintenance of their health and well-being, often at great expense to our own. So maraming nasistress, tayo rin ay nasistress of course, pero patuloy ang paninilbihan. Okay, so the chronic stress has been documented to have had adverse effects on the quality of life and mental health of healthcare workers. A local study done in 2020 showed that majority of healthcare workers had been affected psychologically, more commonly with anxiety symptoms and depressive symptoms tulad nung nasa fun quiz natin. So ito na ang sagot. Ano nga ba ang anxiety at depressive symptoms? Okay? Sa depression, ang hinahanap natin dyan ay depressed mood, low mood. At ang isa pang hinahanap natin dyan ay kawalan ng interes sa dating mga kinagigiliwang bagay. So yung mga hobbies mo, hindi na nagpapaligaya sa'yo. So meron dong changes in appetite, sleep disturbance, mainitin ng ulo, madaling mapagod, hindi makakonsentrate. Paano naman kung anxiety? Meron tayong nagsabi sa chat box, ang nga ba Tagalog ng anxiety? Pwedeng nervyos, agam-agam. So pagka ganyan, ikaw ay mapag-alala. Iba po yung maalalahanin sa mapag-alala. So meron ding fatigue, masakit ang kasukasuan, ang buong katawan, hindi makakonsentrate, irritable. So ang hallmark nito ay ninenervyos. Yung isa naman, yung depression, ay kalungkutan. Okay, sa mga health workers, balik tayo. Ayon sa isang study, ano ang main sources of anxiety reported by healthcare workers? Okay? Primarily, it was fear of becoming infected and unknowingly infecting others. There's huge concern, of course, for the welfare of loved ones and uncertainty about the availability of support. And then, the health information was a source of dissatisfaction kasi it was evolving, pabago-bago syempre. Okay. Now, what we want to do is be resilient. Ano ba yung resilient? Nakalagay dito an ability to recover from or adjust easily to misfortune or change. At ang rekomendasyon pa is, be like the bamboo, bend but do not break. So syempre, in the face of such challenges, we want to be resilient. Okay? And thankfully, merong resilience training that can change the brain. Kasi pagka ikaw palaging stressed, nag-change rin yung brain mo. Mas nagiging active ang amygdala mo. Certain parts make you more prone to getting stressed. But we can reverse this intentionally by working on the other areas of the brain that dampen the effect of the amygdala. And let me explain to you how. So basically, to enhance your resilience, pag sinabi natin resilience, physical, mental, emotional. Pero ang target natin ngayon, mental health. Pero hindi pwedeng mental health lang ang patutukuyan natin. It is necessary to pay attention to factors that improve physical health, particularly sleep, exercise, and diet. Factors that enhance social connectivity, and factors that enhance mindfulness and a balanced outlook. Binanggit ito ng mga na-interview kanina. Okay. So kailangan sapat ang tulog. Kahit sinasabing 7 to 8 hours every night, iba-iba ang bawat tao. Average lang po ang 7 to 8 hours. Some need more, some are okay with less. But adequate sleep per person is necessary for our recovery and healing from daily stress. Okay? So pag kayo po ay kulang ng tulog, lalo kayong sensitive sa stress. Magkakaroon kayo ng tinatawag na emotional dysregulation. Mas magiging emotionally reactive kayo, susungit kayo, and nobody wants that. So on the screen, this can easily be downloaded from the internet. Are recommendations for sleep hygiene. Hindi naman kailangan na laging gamot po ang babalingan natin kapag tayo hindi nakakatulog. Mayroong mga natural means. Bawal uminom ng caffeine, magpatugtog ng relaxing music. So, mayroong relaxing activities tayo pag malapit ang bedtime and so on. Okay, how else can we boost physical health? Siyempre, hindi mawawala ang exercise. At anong klaseng exercise ang nire-recommenda? Aerobic exercise. Okay? Yan ang mas nakakapagpatibay raw sa atin against stress. So, pwede yung walking, running, biking. Okay, and nabanggit kanina ng isang in-interview, mindfulness. Ano ba yung mindfulness? Okay, mindfulness is being in the present moment. And on the screen is an exercise that you can do to help you be more mindful of the present. When we are unmindful, iniisip natin yung kahapon, yung bukas, ang dami nating iniintindi. Pero ang gusto ng mindfulness ay being attuned to the present. And we can hone our mindfulness by exercising our 5 senses. Okay? So wherever you are now, try to do this. Look around you. Find 5 things you can see. Titingnan lang po, hindi hahawakan. Okay? So, may 5 bagay, kahit malayo sa inyo, identify nyo. 4 things you can touch. So, touch, touch, touch. As you touch, please identify. And then 3 things you can hear. Pakinggan nyo. Siyempre, ako naririnig nyo. Kung ano yung nasa paligid nyo. Baka yung gadget nyo, naririnig nyo rin. Then 2 things you can smell. Yung iba challenge dito pero malamang yung shampoo nyo or yung suot ninyo or yung lunch ninyo. And 1 thing you can taste. So nagkape ba kayo? Nagmentos ba kayo? Or kumakain ba kayo ngayon? So this is exercising our senses and being in the present moment. This is a simple mindfulness exercise. Okay, ngayon medyo magle-level up tayo ng exercise. Ang tanong, kamusta ka? How do you feel? Okay. Bakit sinabi kong level up ito? Chances are kasi, ang mga sagot ninyo pag tinanong kayo, kamusta ka? Ang sagot nyo, okay lang, medyo okay, mas okay ngayon. Okay, are you really okay? As health workers, we face a lot of challenges. And it is kind of hard to really be okay. More often than not, the conduct of our profession discourages the expression of emotion. So kahit ikaw ay nalungkot, naapektuhan, hindi mo usually ito pinapakita kapag nasa workplace ka kasi dapat professional ka. Okay? So when work requires expression of an emotion that is at odds with your true emotion, we call that emotional suppression. So effort yan kasi may nararamdaman ka pero hindi mo siya pinapansin. This can lead to emotional exhaustion and may impact on work performance. Unfortunately, if you do it often enough, you're not aware that you do it. You automatically suppress your emotion. It is part of being resilient or self-care, of improving mental health, to be able to express how you feel authentically. If there's anything particularly distressful, create a narrative in your mind. Ano bang nararamdaman ko ngayon? Bakit? Either write it down or better yet, verbally share it with a trusted person. Hindi po pwedeng walang bahala na lang ito. Merely saying, I feel anxious, ninenervyos ako, I feel sad, nalulungkot ako. Just acknowledging it may dampen the very feelings that you are experiencing, okay? The simple act of labeling an emotional experience can reduce stress, okay? So, hindi tayo na-overwhelm or nadadala ng emosyon kapag meron tayong magandang emotional regulation. At isang way pagandahin is identifying how we feel. So, if you can't do it now because likely you're at work, set aside time before the day ends to reflect on how you are feeling. Ayan po, may kode ko sa screen. It's an emotion wheel. As best as you're able, acknowledge and validate how you are feeling. Anong nararamdaman mo at bakit? Meron ka bang inaalala sa ngayon? Sa totoo lang, napakadami po ng choices na alalahanin sa daigdig na ginagalawan natin. Pero ano ang pinaka-relevant na inaalala mo? Okay. So, then you practice self-compassion once you identify how you feel and why. What can you say to validate your own feelings? What can you do to make yourself feel calm and safe? What can you do to take care of your emotional needs? Okay? So these are important steps. So to reiterate, verbally sharing your thoughts and feelings about personally meaningful experiences can improve well-being. Pag-uwi sa bahay, masarap na maikwento mo anong naganap sa araw mo. Magkwentuhan kayo ng family. It will ensure appropriate emotion regulation and encourage family members or friends to share their own experiences as well. Social connectedness is positively correlated with enhanced emotional regulation. So as I said, take time to connect with loved ones and friends. It can increase health-promoting behaviors, improve mood, and reduce distress responses. Now, it's particularly important to have close, meaningful relationships rather than a large network of casual friends. It's not how many Facebook or Instagram followers you have or Telegram friends. Ilan yung close mo doon? Okay. Another way to enhance resilience is to be thankful. Expressing gratitude can have lasting effects on emotion regulation and can boost psychological well-being. You can say just thank you for the blessings you have. You can write it in your diary. Or better yet, think of someone to say thank you to. Gagaan ang loob mo, gagaan din ang loob nung pasasalamatan mo. Okay, let me review a lecture given by Dr. Anselmo Tronco before on mental health and mindfulness. It was said there that most of the emotional reactions to this pandemic are healthy responses to an abnormal, uncertain situation. Ang nakalagay dito ay most, hindi all, okay? So yes, it's okay to not be okay. Pero may degree rin ng pagka not okay that is acceptable. And we would like to highlight that it is inherent in our values as a Filipino to be family-centered and have the bayanihan spirit. So, dapat gamitin natin ito by sharing with our family and friends how we are feeling. Kahit mild lang yung iyong nararamdamang lungkot o pag-aalala, wag na nating hintayin lumala pa. So, may study that showed what are the preferred sources of support. Karamihan ng tao, gusto syempre sa kaibigan o sa pamilya. May iba, swerte na meron silang mentor or teacher na close nila or spiritual advisors. Hindi priority na pumunta sa mental health professional. Nabanggit na may stigma or minsan hindi lang alam paano ba ito pumunta. Okay, but ang gusto lang natin, sino man ang pupuntahan mo, kung kailangan mo ng tulong, basta pumunta ka, makipag-usap ka. Notice on your screen now is a dark slide and it says help-seeking behavior. There's a dark side to help-seeking behavior. And what is that? A study has shown that given a psychological problem needing professional attention, there is a greater likelihood of seeking help for another than for oneself, despite knowing that help is needed. So, ibig sabihin, mas madali para sa mga tao ang mag-isip tumulong sa iba. Ang tanong lagi, paano ba ako magre-refer? Pero yung sarili mo, nabibisita mo ba? Okay. Kapag ang problema na mild ay hindi binigyang atensyon, pwede ito maging moderate to severe. Pwede tayo magkaroon ng clinical depression, anxiety disorder, and we can have suicidal thoughts. Suicide is a very real concern. Among the mental health concerns, ito ay irreversible. Therefore, I urge you do a checkup of yourself. And if you need help, whoever you prefer to consult with, please do so. Ask for help if you are struggling to cope. If stress gets in the way of your daily activities for several days in a row, if you feel you may be misusing alcohol or drugs, even prescription drugs, if you have thoughts of harming yourself or other people, or if you are already being treated for a mental health condition and you experience new or worsening symptoms, please ask for help. If you're not comfortable seeing a professional, start with a friend or an advisor. Basta talk with someone. And here's an option. You can set an appointment at PGH. All right. Ngayong marami na pong nabakunahan and we are gearing up for the tail end and we hope the end of the pandemic. Will the tide wane, do you think? As we prepare for a post-COVID world after 2 years of social distancing and losses suffered, we will need to adjust to yet another normal. Ang tagal bago tayo naka-adjust dun sa tinawag nilang new normal. And some of us succeeded, some of us not so. But now we are called upon to adjust yet again. As COVID subsides, the tide of mental health concerns may yet rise. The outcomes are not yet conclusive and may continue to evolve. How do we stem the tide? Again, let me ask you, how do you feel? Kamusta ka? We start with ourselves even as we check on those around us. Let's talk about feelings as part of self-care. Self-care does not mean me only. It means me too. Taking care of yourself is an essential prerequisite for taking care of others. So to recap, COVID brought challenges to our mental health. The end of the pandemic may yet bring other challenges. There is a lot to be done. Let's begin with ourselves so we can be better prepared to serve others. These are my references, and I go back to the questions posed at the beginning. Ano ang tamang sagot dito sa tanong na to? What should we ask Jake to do? Sino ang dapat kausapin niya? Okay? And if you are feeling exactly the same symptoms, ano ang dapat mong gawin? There should be no discrepancy in the answer to the first and the second. Unfortunately, many people think of referring another person but not looking out for themselves. So I hope with what I have shared with you today, you will take better care of yourselves so that you can take better care of other people as well. Maraming salamat po.
Okay, thank you. Thank you so much. That's Dr. Sandy de la Fuente of the Department of Psychiatry and Behavioral Science at the University of the Philippines, PGH and College of Medicine. Ang ganda, no? Parang sabi ko, ang lamig ng boses ni Sandy, tsaka parang akong therapy sa kanya. Parang sumusunod ako sa mga exercise. I'm sure, Sandy, you'll see how our audience really appreciates your talk. And I'm sure there will be questions. So those of you who have questions, please go to the Q&A box. Tsaka sinasagot nila yung post test, pre-test and post test. Okay. Thank you so much, Sandy. Napakahusay, napakaganda. Okay, Raymond, ikaw naman.
Thank you, Dr. Susie. Malamig nga yung boses ni Dr. Sandy. It's as if you're listening to someone just telling a fairy tale story. So thank you po, Dr. Sandy, and we hope you'll be able to join us mamaya po sa Q&A session later on. We will move on to our next speaker, who is an obstetrician and gynecologist by practice po, but as a UP Manila official, she is the director of the Office of Student Affairs in the University of the Philippines, Manila. Please welcome to your screens for the very first time, Dr. Blesile Suzette Mantaring. Dr. Bless.
Good afternoon. Magandang hapon po sa inyong lahat.
Good afternoon, ma'am.
Okay. Before I start my talk, I would like to have a declaration of interest that even if I'm a faculty of UP College of Medicine and Department of Anatomy, I have no commercial or financial interest in any of the contents of my lecture. And my only interest is the welfare of the UP Manila students. So this is a present scenario that many of our students are facing today.
Ma'am Bless, can you make it a little bit bigger? See, we see your desktop.
Sorry. Wait, I'll stop sharing first.
Okay, ma'am.
Okay. Is this better?
Yes, ma'am. Perfect. Thank you, ma'am.
Okay. So this is the present scenario that many of our students are facing today because of online classes. So they sit the whole day staring at their gadgets while they're doing their online classes during the past 2 years. There is no time constraints. Nag-aaral sila any day of the week, kasama na doon ang Saturday and Sunday. They can study any time of the day, sometimes even midnight, just to have a good internet connection. Aside from this, multitasking is present. Aside from studying, they are also expected to do their household chores. And social interaction with family and friends is limited to social media most of the time. So the UP Manila, through the programs of the Office of Student Affairs, would want to transcend or improve this scenario. In adapting to these new circumstances, wellness should be integral to the daily lives of our students. I would like now to talk about how UP Manila addresses the well-being of our students. During pre-pandemic, we had what we call the Psychosocial Wellness Network, or PSWN program, to address the emotional needs of our students. Because even before pre-pandemic, we already saw increasing mental health concerns of our constituents. And with this PSWN, it will widen the reach of mental health care, originally offered only by our guidance counselors through the Office of Student Affairs or the PGH Department of Psychiatry and Behavioral Medicine. Now, this PSWN is a collaborative work of 7 of the 9 colleges of UP Manila to foster a healthy and responsive campus climate. It is headed by the OSA director, and we have several members. It will include a college student relations officer from each college, who is also a faculty member, all our OSA guidance counselors, a student representative, usually the chair of the University Student Council, and representatives from the Department of Psychiatry and Behavioral Medicine. And this is usually attended by the chair of the Department of Psychiatry. We meet regularly for updates, as well as to discuss methods and strategies to promote mental health and share best practices related to student support. We follow the multi-tiered public health approach, which is recommended by the WHO, wherein we give emphasis to the promotion of mental health in the community. We also want to prevent or minimize health and behavioral disorders among at-risk members, and treatment or intervention for those identified with mental health challenges. Hence, we meet all the needs of our constituents, all those who are healthy mentally, those who are at risk, and those who will need help for their mental health challenges. Now, in the middle of the pandemic, a crisis management and foresight planning workshop, which was hosted by the UP system, was done, and it was agreed that there should be a constitution of what we call a subcommittee on students in distress in each constituent university. With this establishment of subcommittee, the PSWN was incorporated into this subcommittee with the same members, except for an addition of 2 colleges, the NTTC, HP, and our extension campus, School of Health Sciences, which is based in Baler, Coronadal, Palo, and now Tarlac. This is now headed by the Vice Chancellor for Academic Affairs. This is a very important step for the UP system, because the UP system now gives emphasis to the mental health of all our students. Now, all UP Manila students are required to have an annual physical examination and mental health evaluation during the start of the academic year. And students who have limited face-to-face now are advised to undergo this examination. This is actually a requirement before registration. So they have to fill up a periodic health exam form and submit this to the health service. Once they fill up this part, they also have to fill up what we call the Patient Health Questionnaire, or PHQ-9, which is a tool to measure, to screen, to diagnose, and monitor the severity of depression of our students. This PHQ-9 is, the score is added up, and depending upon the score, we can see here in the table that students with a score of 5 to 9, diagnosed as mild depression, will be referred to our guidance counselors. 11 to 15 to the Department of Family Medicine and Adolescent Pediatrics, and greater than 15 will be referred now to the Department of Psychiatry. So we already have our limited face-to-face classes in some of the colleges, and from the interval of July to September 2021, we had a total of 953 students who had or will undergo face-to-face. They underwent the annual physical examination, and through the PHQ-9, 8.7% of these students, or 83 students, were referred to the concerned offices, as seen from the table. Due to the social isolation experienced by our students, our guidance counselors had an audio and visual technology to have a wider reach of our students who have mental health concerns. These services are offered daily during office hours. Individual counseling services were given through these various modalities, such as emails. We have our mobile app called the Lift Up, which is an online chat platform between students and counselors. We also have audio or video calls using the Google Meets or Zoom, or we can, the student can call or do an SMS to our guidance counselors. We also have group counseling with a tagline using Usapang Babuhay, Buhay na Usapan. This is given to the undergraduate colleges of UP Manila, and the students voice out their concerns for the possible face-to-face classes that they're going to have. Now, this is the Lift Up. It's a mobile application. It's a live chat between our guidance counselors and students with anonymity on both sides. Meaning, hindi alam ng students kung sino ang guidance counselors ang pipiliin, ang kinakausap nila, o yung guidance counselor, hindi rin kilala kung sinong student o kung anong college nang galing ang estudyante. Therefore, this anonymity provides a platform for the open discussion of mental health and counseling for mental health problems in a safe, inclusive, non-threatening, and non-stigmatizing environment. So the students can choose from the person they would want to consult. You can see here that there are no names. They can either choose an OSAP guidance counselor, or they can choose a peer facilitator. Peer facilitators are student volunteers who trained under the Office of Student Affairs. Unfortunately, we presently have no peer facilitators available since the start of the pandemic. From this graph, you can see that there are many reasons why students use the Lift Up, from interpersonal reasons such as they feel stressed or anxious, to family problems, to psychopathology situations, and academic performances. OSA also has an online mental health survey that was started last 2020 to assess the emotional state and resiliency of our students. We only had the soft opening, so we only opened this for freshmen. And we use the following scales to measure the emotional state of our students. We use the DAS-21, the Depression, Anxiety, and Stress Scale, which measures the emotional state of depression, anxiety, and stress. And we also have what we call the Brief Resilience Scale to assess the perceived ability of the student to bounce back or recover from stress. And the data that we gather from this can be accessed by the student relation officers of each college. And from the data, there is a difference in the DAS and resilience scale of freshmen from the colleges in our main campus and from SHS, or which is in Baler, Coronadal, and Tarlac. So from this data, we can see here that the DAS rating scale of students in the colleges of UP Manila showed, and SHS will show mild depression. Both will also shows moderate anxiety. But for the UP Manila campus, main campus, there will be mild depression, mild stress. But for students in SHS, there are normal stress levels. The resilience scale for both UPM and UPM SHS are in the normal levels. Now, for the academic year 2021-2022, UP Manila showed mild depression, while SHS has normal scale for depression. Then for anxiety, both main campus and SHS will still show moderate anxiety. And then for stress, UP Manila campus students will show mild stress, while there is normal stress for SHS students. This is and resilience is still the same, normal resilience for both. Now, this is probably understandable to have a moderate level of anxiety because of the uncertainties experienced by our students during this pandemic. But you can also see that the depression and anxiety levels did not progress to the severe form because of normal levels of resilience of our students. All students will also need to fill up what we call the UP Manila Bayanihan na Employee Symptoms Tracking System, or what we call BESTS. It is a web-based application designed to help monitor and keep track of the health status of all employees and students. They are required to log in their temperature and any self-assessed symptoms. These reports will be generated and emailed to the head of offices and the focal person of each college. For example, as head of the Office of Student Affairs, I can monitor my staff's condition. It will show the temperature, the symptoms, the date assessed, and possible exposure to COVID of my staff. There is a flow process that UP Manila will follow. This is used as a guide on how to deal with faculty, admin staff, and students with possible COVID-19 exposure or infection. There is also a focal person identified per college to assist employees and our students who show symptoms of COVID-19 infection. The BEST app alerts the focal person or supervisor of their condition. UP Manila also has undergone several steps in order to prepare for face-to-face classes. Such as all students who are now undergoing limited face-to-face should all be registered with PhilHealth or an equivalent medical insurance. There are also retrofitting of the classrooms and laboratory rooms. The traffic flow of students in campus is also ensured, so there are arrows to show the students where to pass during ingress and egress out of the buildings. And students and faculties are required to have complete vaccination. For example, in the College of Medicine, we have to access a QR code for daily symptom monitoring, and our temperatures are checked at each point of entry. The subcommittee of students in distress also had 2 recorded videos given by 2 nurses from the College of Nursing and from the Philippine General Hospital. And the topic was strengthening self-care and coping through stressful times. This will be given to all the colleges, and the SROs are expected to show these videos to all of their constituents. There is also an ongoing telehealth and wellness program, which is sponsored by the College of Allied Medical Profession, wherein there will be regular group exercises sessions to start a more physically active lifestyle for all constituents of UP Manila. The program aims to improve health, the physical fitness and wellness of our constituents through exercises and helpful health education, led by a team of physical therapists and physical therapy interns. But before you can enroll into this program, you have to undergo a quick screening procedure in order to ensure safety prior to participation. And after a period of more or less 8 weeks, the progress of the participants will be checked again. The Subcommittee on Students in Distress also did a survey. It was answered by both faculty and students. In the survey answered by faculty, the faculty were asked questions to determine their perception on how their students experienced distress and how they responded to this distress. And in the survey answered by the students, almost similar questions, they were asked their personal experience of distress. And the results of these 2 short surveys will be used by the Subcommittee on Students in Distress to develop intentional and context-focused psychosocial intervention for our students. Now, for the next few slides that I will present, this shows the responses of both the faculty on their perception on a student's distress, which is color pink in the table, and the student's own perception on distress, which is color blue. In the majority of the questions, you will notice also that the faculty's perception of how the students respond to distress is almost consistently exceeds the actual perception of the students. So in this question on effects of distress to students, changes in eating habits will have the nearest response rate for both faculty and students on the question, how does distress affect you? Now, for the question, which of the following concerns at home can cause you distress? both students and faculty will have the topmost answer, which is unclear boundaries between schoolwork and household chores, which is what I mentioned earlier in my slide, that there is really multitasking of the students. No? They are not only expected to do their schoolwork at home, but they are also expected to contribute to help in doing the household chores. So here, for the students, there are conflicting priorities. They don't know what to do first. Will they study first or will they help at home? Now, which of the following can cause you distress when you lack any of this? The lack of physical interaction is the most common answer for both faculty and students. But for the students, the absence of leisure and recreation and socialization have severely affected them. Is the COVID-19 pandemic a significant stressor to you personally? Both faculty and students agreed that it is a significant stressor for students. And how have you been coping with the stress? Now, for both faculty and students, the most common answer here will be browsing on social media such as Facebook, TikTok, and listening to music. And but an additional answer coming from students will be sleeping and resting and connecting with friends online. As a summary, I have presented the various programs of the Office of Student Affairs as well as UP Manila to address the well-being of our students. Surveys and online assessments will help our office and the university to develop programs and mechanisms to meet all the health needs, not only of the students who have mental health concerns, but all of our students. Thank you for your kind attention.
Okay, thank you very much. That's Dr. Bless Mantaring. Ganda rin ng presentation niya, no? Puro data. And I think that kind of analysis really helps us understand ito naman from the point of view of students, no? Ano ba yung mga stressor nila, tsaka paano natin silang matutulungan? And I was taken aback by the multitasking thing, no? Na parang kala natin siguro mas madali para sa mga estudyante na hindi sila pumapasok, pero actually nakaka-stress din yung sa bahay sila. Anyway, we are now going to go into our open forum and we're going to ask Bless and Sandy to open their cameras. I think we don't have Dr. Bollet, but we'll proceed. But prior to that, Raymond has an announcement. Go ahead, Raymond.
Very, very quick announcement lang po, no? Before we go into the Q&A session, we have I think the first of a new set of public service announcements for today. Take it away, TVUP.
Aloy, bilisan mo! Dali!
Wala!
Ha? Ano nangyari? Ba't hindi kita makapitan?
Handa ka na ba, Kaloy?
Oo naman, ate! Nabakulahan na kami. May powers na kami laban sa inyo.
At hindi nyo na kami basta-bastang makakapitan. Yay!
Sisiw!
Kaya mga bata, magpapakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Okay, thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children ages 5 to 18 years old.
Oh, di ba na extra pa tayo doon, Raymond?
Una pa lang po yun. It's a set of
there's a series.
short
And I think,
videos.
well, nakita nyo naman po yun dati, no, na we're talagang promoting na vaccination of adults, particularly seniors, kaya mga bata naman. So, tulong-tulong lang tayo dito, no, para tuloy-tuloy lang yung pagbabakuna natin. Okay, so Raymond, let's start our panel discussion. Actually, I saw several questions in the Q&A, and we'll take them in a moment. But I had a question both for Sandy and for Bless, no. Yung health workers natin, I would say, would you say na to begin with, they're resilient? Di ba? Kasi para maging health worker ka, nakakita ka ng may sakit, nakakita ka ng sinaksak, nakakita ka ng namamatay. So there is some level of resilience among the health workers. Do you think na there is additional training that's needed for frontliners? And in the case of Bless's presentation, our students of medicine, our students of nursing, do we have to do more in terms of training? Kasi the pandemic was a completely different kind of stress. And if we do, what do we need to do? Sige, so ano muna, Sandy, anong tingin mo dyan?
Siyempre, the answer I think would be yes. I agree with you that healthcare workers become resilient over time. They may not have started out resilient, but when they chose to go into this field with experience, they do become more resilient. However, yes, I would agree with further targeted training. Kasi nga, now that we have experienced this pandemic, but even prior to the pandemic, there were disasters. And we need to address yung emotional concerns nga. Kasi usually, hindi na naman yan ang nagiging target natin when we are trained to be healthcare workers. Nandun tayo sa competence. Pero kailangan din na pag-usapan ang feelings natin at paano ba ito i-manage, tapos ang feelings rin ng ibang tao. But bakit kailangan ng training? Kasi nga minsan wala kang oras eh. Paano ba ito ginagawa ng mabilis, di ba? Kasi hindi naman pwedeng bawat kausap mong pasyente, matutugunan mo. So I think the training will be there. So in our college, this is being addressed already. Anyway, that's my answer. Maybe Bless.
Bless, what are your thoughts on that?
Well, I agree that even students should have training in preparation for facing patients, especially medicine, facing patients during their rotation as interns. Kasi interns ngayon ang nag-face-to-face. But I know that there are orientations given to interns to help them, the do's and the don'ts on what to do when they are in the hospital, what you have to wear, the PPEs, what is expected of the PPEs. But I also see the appreciation of interns when they do face-to-face, because I have a son, an intern now in PGH, and he really appreciates the face-to-face interaction that he has, because nothing can replace face-to-face, particularly for this kind of work. And he's really very appreciative of all the orientations and all the do's and don'ts that the hospital admin is giving to them. Also, the College of Medicine has their own Office of Resiliency, which really tries to help all students in the college to overcome any anxiety and stress. Although sometimes it's really hard to reach out to all the students, because sometimes the students really don't want to be helped. They really need an open mind in order to receive the help that the college and the hospital is giving to them. That's it.
Yeah, thank you, Bless. One more question before we go to the questions for the audience. And this for Sandy, because someone was asking me this and I wasn't very sure how to answer it. Can you explain to us from a psychological point of view, how come we were all looking forward to going out, no more lockdown and so on, and yet people are still anxious. Parang gusto pa rin magpa-test kahit hindi naman kailangan, di ba? Yung parang gano'n. How do you explain this? So parang we were looking forward to something, and then now that it came, parang people feel the same. They still feel na parang, ay nako, hindi pa to ganon. Yung bang ganon. So how do you explain that, Sandy? What is your explanation to that?
Doc Susie, di ba? It took time for us to get used to the pandemic. We were told to get used to the new normal. So unti-unti, We learned new ways of dealing with the situation of being in isolation. So it took time, and finally we learned, 'di ba, na magpapatest ka, mag-isolate ka, didistansya ka sa tao. And now after 2 years, we are supposed to be going back to how it was before. But we know it is not as it was before. The pandemic is not yet completely cleared. Therefore, yung kaba mo, syempre parang reality-based naman yan dahil yung virus nag-e-evolve siya, 'di ba? So, mahirap maging kampante. Kahit gustong-gusto mo lumabas, hintay ka muna ng senyales na talagang safe na. So the excitement will remain, but the action will have to wait until we all feel really safe. And that will not be coming very soon.
Okay. Sige. Raymond, we've got some questions, some very interesting questions in the Q&A.
Okay.
Q&A box. Go ahead.
Dr. Susie, I'll be picking one from the chat actually, from Ma'am Jovenia Celo, who says that she is the chair of the scholarship committee of the UP Alumni Association in America. They've been doing some fundraising to help UP Baguio students with their psychosocial problems. So aside from psychosocial problems, those students also are financially challenged. And so her question is, are there any other constituent universities other than UP Manila that can offer help? And is there anything else that the UP College of Medicine or UP Manila in general can provide in terms of services for students within the system naman pero from other CUs? I'll pose it to Dr. Mantaring.
We all the directors of the Office of Student Affairs, we have regular meetings that will be under the UP system. So we meet regularly and we discuss the problems of our universities. And from this, we have come up with certain steps. For example, helping the students financially through the GIAP program of the university. We also have the Kaagapay program that helps also financially needy students in need of gadgets, for example. Pero dahil nga sa dami ng estudyante na nangangailangan, the system really cannot answer all the needs of our students. So we really have to classify the students based on their income level. So those who are classified as really in the poverty line, then they get, for example, a gadget and a monthly internet connection for one academic year. And then the next level will only get internet connection. So it really depends on the income of the parents. Also, the system is so conscious about the mental health of our students that we already have come up with a program that will give financial aid to the students who have mental health concerns, to help them, for example, in their expenses to buy their medicines, or, for example, in order to consult a psychologist or a psychiatrist. So this is still undergoing study, but I think by the next academic year, may establish na rin itong program na to.
Yeah, thank you, Bless. No, I think, parang we're doing that in UP. I don't know, do we know what's happening in other institutions outside of UP? Parang meron din bang mga ganitong...
I'm also a member of SMEC, which is the South Manila Educational Consortium, the SMEC. And we also have a group of the Office of Student Affairs, and we also meet regularly. And I think all schools, in SMEC, are helping their students through mental health support and financial assistance. So this is also being talked about by other universities.
Yeah, good to know, no? Good to know. Sige, Raymond, meron pa dyan.
Question naman po, I'll pass it on to Dr. Sandy, coming in from Professor Emeritus for Psychiatry, si Ma'am Lulu Ignacio. So what does it mean po when normal resilience result? So yun po yung kanyang katanungan, Ma'am Sandy.
Unang-una, na-stress ako doon. I'm sharing my feelings and adding my own advice. Pag si Dr. Ignacio, talagang I'm reduced to studenthood. Okay. So yung normal resilience result, I can only define what resilience is, which is like the ability to adapt or to bounce back. So it is our aspiration to be resilient. So that is the only way I can define resilience. As if I cannot say if there's abnormal resilience, I think all resilience should be normal. And that is the aspired result. I hope Dr. Ignacio is happy.
Yeah, Dr. Lulu, you might want to talk, no? No, I think that's a great question. I mean, I guess if I were to rephrase that, right, it would be like, how do I know that I'm resilient and that I'm coping well? Right? If I'm a health worker and I'm super stressed out, I have older parents I'm taking care of, yung anak ko nagka-COVID, how do you know that you're resilient? Dr. Lulu, you might want to join
Or
us.
is there something, Dr. Sandy, na high resilience result and low resilience result? Something, a spectrum ba? Is that thing?
Ang naisip ko na term is high functioning, low functioning, or sakto lang. We're going to go to issues of normality. Ano ba ang normal, diba? Meron kasing optimal yung functioning na mga superhero sila, diba? Pero ilan lang ang ganon. So parang we aspire to be basic human beings. We struggle every day. Pagtulog mo, nagawa mo ba lahat ng kaya mong gawin? And you are grounded in your capacity. All right, may I phone a friend? I see on the screen, Dr. Ignacio. I will be quiet now and turn the floor over to ma'am.
No, I was just struck by Dr. Mantaring's survey result as normal resilience. So it struck me. I said, what is normal resilience in a survey result? That's it lang.
Yeah, okay. So for our audience, no, that's Dr. Lourdes Ignacio, who is Professor Emeritus of the UP College of Medicine and PGH in Psychiatry. And Lulu, you want to talk about why it struck you?
Actually, Sandy has answered it. Resilience is part of us. We are basically resilience. So what is that thing in the scale na normal? You should have resilience as a human being. You bounce back. We cope. And then we cope. But then the first step is resilience. Anywhere, disaster, problems of daily living. But I was struck by the survey result on students. Normal resilience. So I'm asking Dr. Mantaring, ano ang source ng result na yan? Because I think it's very confusing.
Ma'am, what we used was the brief resilience scale. I think that was answered by the students. And based on the scoring, there was within normal limits ang resilience. We interpreted it as the ability to be able to bounce back if there is any stressors in their lives.
Yeah, because these resilience scales are really to be contextualized. That's all I have. I mean, I was really struck by that.
Okay. Yeah. I mean, I like this discussion. No? Parang, parang we can't take everything at face value. Sometimes when we hear things, no, parang, what exactly does that mean? Yeah. So I think Bless answered the question and so did Sandy. Okay. So let's go to some more questions, Raymond. Yeah. Thank you very much.
Thank you.
Thank you, Ma'am Lulu, and thank you, Dr. Mantaring. The question naman po, and I'll just choose from our most upvoted. What is high function depression? Is it healthy as a coping mechanism? That coming in from Nora Villanueva po. Ma'am Sandy?
When we say depression, high-functioning depression, okay, the term depression, merong regular everyday depression, merong clinical depression. Kapag sinabi mong clinical depression, meron na yang effect sa functioning. At ang functioning ay personal, social, occupational. Okay? So kapag ito ay functioning depression, ang iniisip ko, ang tinutukoy dito ay yung nararamdaman nating kalungkutan. Dahil parte yan ng nararamdaman ng tao, hindi naman tayo everyday happy eh. 'Di ba? So, what is the question? Kung healthy coping ba ito? Well,
Yes, ma'am. Is it a healthy coping mechanism?
Yung ano sabi Raymond?
The term used po is high functioning depression. So, yun po yung, at least for the question.
Kung healthy coping ba ito, if in the face of regular run-of-the-mill sadness, you can still function, then you must be drawing upon good psychosocial resources. At saka, you're just grounded na it's natural to be sad sometimes. So that would be my answer to what I understand the question to be.
Yeah, I have a follow-up question to that, Sandy, no? Kasi some people who have depression, their experience is not sadness eh. Parang ang experience nila is that they don't feel anything. Yung sinabi natin kanina na yung dating nakakagiliw ay hindi na nakagigiliwan. Na parang wala lang, there's nothing. So how is that the same depression or it's something else?
Okay, so yung depression kasi, marami siyang criteria, pero ang top 2 na hinahanap mo nga dyan ay depressed mood or loss of interest in usually pleasurable activities. So yung sinabi mo, kinukonsider nga sa criteria na may ibang tao nalulungkot, pero may ibang tao nawawalan na lang ng gana, ng pakiramdam. So that can also be depression. Meron ding tinatawag na agitated depression. Pero basically, it is a negative, low mood. You don't feel your usual self. So depression can present in that way.
Yeah, okay. Raymond, meron pa tayong okay,
Well, there's
it's a question, no?
Opo. There were 5 questions po kasi that were already answered po by Dr. Sandy. This one, I'll pick one from from Renato Joseph. Although medyo nabanggit na rin naman to ni Ma'am Bless, I'll just read it. Can you share with us how PGH Health Services, if may referral daw po, I guess, in terms of handling cases as it relates to the mental health condition of the students, does it affect their standing as students in the university? And then he has a recommendation. He hopes that the program can be shared with other schools dahil kailangan po ito ng ibang students sa ibang mga schools po. So I think it's much more of the coordination, Ma'am Bless, by OSA, with their findings, and if there's especially if you have counselors, paano po ba yung if it requires referral, ma'am? You're on mute, ma'am. Sorry.
The last few slides that I've shown are just recent data. I just got it a few days ago. So the subcommittee will have to work on this, on the programs that will be needed, particularly for students in distress. Our guidance counselors has received several referrals, not only from UP Manila, but also from other schools and from other constituents, other UP constituents. So it's really open. Even the Department of Psychiatry is not only for PGH, but to all. They really answer, okay, kaya nga, hirap rin ng residents ng psychiatry to help not only our constituents, but also to help the outside people from to help in their mental health concerns. Well, we are naman willing to. I've been invited to several talks already on how to help with their students, and I've introduced already some of the programs, and I hope some of the universities that I have talked to can pick up on this.
Yeah, Raymond, I have a question here for Sandy, no? Kasi one of the things that we've noticed or we've heard about, right, is that we have many residents and even nurses who are quitting. They're quitting their work. And Sandy, would you like to talk about what's happening there? What's going on with people that they're, what should I say, that they're coping is to quit.
I will make 2 comments, okay? I want to follow through on what Bless said earlier, that the Department of Psychiatry is accepting referrals from all UP units. At binanggit niya na nahihirapan ang residente rin namin. Okay? Related to that, one of our projects that I'm hoping to get off the ground soon is capacity building. The WHO is promoting interprofessional collaboration so that people will not only expect to see psychiatrists. Meron din naman kasing psychologists, meron din namang social worker, maraming mental health professionals, hindi lang psychiatrist. So, gusto natin ma-enhance yung capacity at yung awareness para ma-address ang mental health concerns. So that is we actually are starting on this project now. It's one of my academic improvement programs, and we hope to update you on that in the near future. Number 1. Number 2, residents who eventually quit. Okay, I'm happy to share that the numbers have been improving. Nung pandemic, there were a lot, like last year, last year. Pero
also nurses, Sandy. Also nurses, no? Parang maraming hindi na, parang they just quit, no? Parang
okay, kasi may iba, hindi ko alam yung hard data. So this is just like my opinion. Nung pandemic kasi, survival mode ng tao di ba? Hindi resilience ang pinagtatalunan nung simula buhay. So hindi ka magugulat na many people decided to withdraw. There are many people who may be young and able at baka hindi naman sila delikado for COVID, but they live with family members who are elderly, okay? So I would think that was also an important factor. The people they live with and their fear for the physical safety. Kasi I've interacted with actually consultants who actually left their positions, they quit. And they're coming back now. And that was the reason they gave, to protect their family members. Now, on a personal level naman, talaga namang kakaiba ang pandemic. So kahit gaano kakatibay, pwedeng ito na yung katapat mo. So, yun din so it's multifactorial. The residents and the nurses, it's a multitude of reasons. But foremost would be the reasons I hear: love for family, concern about welfare. Katulad nung shinow ko na slide, fear of infection, uncertainty about what's going on. So that would be my answer to that question.
Thank you very much. Raymond, meron ka pa?
Thank you, Dr. Sandy. Well, meron po dito, palagdag lang po, no? I'll choose one coming in from Matthew Ivan Kurt. So he's curious to know what coping mechanisms have been most prevalent po based on the consultations, etc. during the pandemic. So yun po yung his question with regards to that.
Most common coping is connecting with people, which is a good way of coping. Depende na lang nga nitong pandemic kung gaano ka-creative at resourceful. Kasi bawal yung face-to-face bawal yung naglalapit. So pwedeng telepono, pwedeng Viber, Messenger, Zoom, what have you. So I think that's a good way to cope. A not good way to cope is shopping. Okay, sorry. Nag-spike. Dumami mga delivery people. Yung economy medyo na-challenge pero nag-boom ang mga shopping online services. So, shinare ko lang, yun ang coping. Bahala kayo mag-judge kung good ba yun. Kasi depende, di ba?
Yeah, there's an interesting question here. Is bullying or verbal abuse in the home a manifestation of depression? So we've heard a lot of stories about the increase in child abuse and domestic violence at home during the lockdowns. No? Are those signs of depression or is that something else?
All right, maybe a very cryptic answer would be hurt people hurt people. somebody, a bully, hurt other people, this person is probably hurting for some reason. We can't categorically say na depression ito for sure. It could be many things. But definitely, this person is probably hurting inside too.
Diliman, do you have another question?
These are actually I'll just aggregate po, no. They're asking about peer support programs on mental health concerns, etc. My question, so I'll just input my question. How does, so Dr. Mantaring mentioned kanina na the directors of the Office of Student Affairs all over the system, they regularly meet, etc. So, meron po bang interface with, let's say, kunyari, PsycServ or other constituent universities that may have their own local programs, not necessarily out of OSA, pero yun po ba ay napag-uusapan at meron po bang pagkakakilanlan at intention to work together, integrate, etc. Yan po.
That's going to be hard. Lift Up started from PsycServ. So it was developed from PsycServ, and then UP Manila added its own needs. Kaya naging UP Manila app to. But it's really going to be hard to integrate all the UP Manila universities to talk in one app. Kasi unang-una, kung sino ang tatao doon. That's our problem rin eh. Kasi now the people who are manning the Lift Up in UP Manila are guidance counselors. And we should also respect their mental health. So they can only man that app during office hours. So our problem is after office hours, who is going to man that Lift Up? Wala sa ngayon. And then the weekends, wala rin sasagot sa Lift Up. So that means it needs additional finances to get more people to man that mobile app. And then to think of it in a wider scope to include all the constituents of UP, for example, that's even a harder task kasi that needs malaking trabaho yan. It's a very big project that we have not really talked about kasi we're just talking now about what each constituent is doing on their own campus.
Okay, thank you po, Ma'am Bless. I have an interesting naman. So, we have been for the most part talking about students, the youth, etc. po. But this question comes in from Frances Therese Marie, and I'll post it to Dr. Sandy. Paano naman po yung sa mental health ng mga elderly if they experience loss of interest or some other mental health symptoms po because of loss of friends by death? Tapos, dahil po social distancing po, no, coupled by the fact na hindi po sila techie, tapos hindi rin po sila pwedeng lumabas. How often do you see those kinds of patients and ano po ba ang advice that usually given to them?
So I would say that the elderly have been among the hardest hit by the pandemic kasi one patient comes to mind. Ang kaligayahan niya dati ay manood ng sine at makipag-zumba sa mga kaibigan niya. Okay. So nung nagkaroon ng pandemic, meron siya mga kamag-anak naman na techie. So yun ang sagot. Kung ikaw ay elderly at hindi ka techie, for sure meron kang kamag-anak na bata na techie. Yan. Pero iba pa rin syempre yung face-to-face. Hindi pareho ang Zumba na virtual at Zumba na kasama. So talagang ang usual na payo, you mobilize family members and friends. Parang gagawa ka ng Monday group, Tuesday group, parang dapat meron silang kinaka-excitan sa araw-araw. I would recommend routine. Okay? Kasi kailangan na yung mental health ng mga kamag-anakan, alalayan mo rin. Hindi naman iisipin, di ba? So come up with a routine. So let's say, every Monday, ito yung kausap niya. Every Tuesday, isi-spread mo. Tapos you form a social network. Kasi marami namang elderly in the same boat. So why not like start a club for them with whatever resources are available? Kasi nga, di ba, marami rin naman, Yung mga Viber, yung mga Messenger, mas madali yun matutunan for some kesa yung Zoom eh. Meron pang doxy dyan. So basically, ang gusto may paraan. Ang ayaw may dahilan. So yun lang ang ano ko, resourcefulness, which is very Filipino.
Okay, there's a good question here, Raymond, from Maria Elena de Guzman. Is avoidance a good coping mechanism from toxic environments and toxic people?
Okay. Avoidance is necessary at times, okay? Kasi hindi ko naman sasabihin sa inyo na sugod. Okay, pero hindi pwedeng only ang avoidance mo. Dapat, ang gusto kasi natin, harapin ang problema. Pero you don't like do it unprepared. Avoidance is a temporary respite. Kung may sobrang toxic na tao, medyo bumuelo ka. Okay? So my answer is, there are times when avoidance is necessary. But it cannot be your go-to indefinitely. You need to develop other skills. Hindi pwedeng yun lang ang skill set mo. More pa. Yun.
Okay, thank you. Raymond, anything else before we start doing our closing remarks?
I think that should be it, Dr. Susie.
Okay, so thank you very much. We're going to give our speakers a minute or two to just formulate their closing remarks for our audience. This has really been very informative, and I think our audience has been very much engaged in thinking about what was discussed now. So we're going to do you want to answer the questions first, Raymond?
Let's answer the questions po.
Okay, let's answer the
Thank
questions.
you. Okay, can we have the Menti on the screen as well? Okay. So, the two questions that we have, alin ang maaaring senyales ng depression? So, hindi po ibig sabihin nito, one answer lang po. You could choose multiple answers among these. We have 1, 2, 3, 4, 5 options. The topmost, at least for Zoom, is walang gana sa dating kinagigiliwan at 84%. That's followed by hindi makatulog at 72%, and then walang gana kumain at 66%. For our second question, alin ang maaaring senyales ng anxiety? Again, multiple choice din, multiple answers din po ang pwede dito. Number 1, hindi mapakali or restless was chosen as the top most answer at 78%. That's followed by nervyos at 69%, and then closely followed hindi makakoncentrate at 68%. So before we shift to the final messages po from our panelists, we'd like obviously we know that everyone is medyo busy po, no, at nagkakaroon po sila ng kanilang mga kanya-kanya pong ways of skimming, especially YouTube, especially those who will want to look at our channel at TVUP, is a youtube.com. We'd like to remind you that we have very, very short snippets po that we fondly call our SCD shorts. Ito po ay mga maikli lang po na mga video clips. Very, very important points mentioned in just short videos po coming in from our webinar. So please do visit youtube.com/TVUPPH for you to be able to look and be able to view our SCD shorts po. And then lastly, we'll go into our evaluation poll for
Sinagot pa natin yung questions, Raymond?
Yes, Dr. Susie. Yes, we did. No.
All of the above, ano? Lahat pwede.
Yes po.
Lahat
yes po.
tama.
Pwede po. Yes po.
Yeah, okay. Tsaka I was just gonna say, Raymond, before you go into that, you were mentioning the shorts, no? After this webinar, this whole recording will be available on YouTube. So I know I saw it in the chat that you found Dr. Sandy very therapeutic. So you can go back and watch it again. And I think there's really a lot that we can learn from this particular episode. Okay, go ahead, Raymond.
Thank you, Dr. Susie. Before we ask our panelists for their final messages, we'd like to show on the screen the evaluation poll. Just a quick reminder again that we are not distributing any separate evaluation polls po, no? Can we have it on the screen? unless we are having problems again with the evaluation poll. It's a 4-point Likert scale for each of the 5 questions that we have right now. Okay, we're just waiting for the poll question to appear po, no? Okay, there we go. So, questions are as follows. The panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. The panelists spoke clearly and audibly. The panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing virus-key COVID-19 health issues. Ulitin ko lang po, wala po kaming nilalabas na hiwalay na evaluation poll. Ito na po iyon. So, we hope that you'd be able, especially if those, umabot po tayo ng almost 1,200 kanina sa Zoom at least. So, you'd be able to join and input your feedback dito po sa ating webinar for today. We will not be closing our evaluation poll as we move on to final messages from our resource speakers.
Okay, we'll go first to Bless. Your parting words for our audience.
I did not mention this in my presentation, but we asked the students if they know about the programs of UP Manila and OSA. And it was disappointing because a little less than half didn't know about our programs. And I think the main thrust now of the Subcommittee on Students in Distress and OSA particularly is to really broadcast all the projects, all the programs that we are offering to the students, because it is only with the knowledge of the students, it's only when the students know that there is help being offered to them that we can really help all our constituents.
Yeah, thank you very much. It's Bless Mantaring who's handling this support services for the UP students. Okay, Sandy.
Siyempre, ang parting words ko have to do with caring for yourself. So as you would care for another, do care for yourself as well. You have only one you, and no one can do you better than you. Take good care of you. You matter, we all do. Bow.
Thank you very much, Sandy. And we're seeing here in the chat that some of our participants are saying we have to do more sessions like this on mental health. So we're going to respond to that. Okay, so for our closing remarks and our synthesis, we've got the Deputy Director of the Philippine General Hospital, Dr. Stella Legaspi Jose. Stella, the floor is yours.
Thank you very much for this enlightening webinar from Dr. Blesile, Suzette Mantaring, and Dr. Evangeline de la Fuente. We all learned a lot from your talk, and it is greatly appreciated by all of us in TVUP. The talk of Dr. Sandy on the stress response, she said that the amygdala of the brain is turned on when there is a stressful situation, and chronic stress happens when what you are doing and what you feel you should be doing are different, so it causes a stress in you, and this is documented to affect you psychologically. She differentiated between depressed mood and anxiety. She said when depressed mood, the person is of course she has a low mood. There's lack of interest in the things that she usually like to do, and there is sleep is hard. She has a hard time sleeping and also eating. So in Tagalog, this is kalungkutan. While anxiety in Tagalog is ninenervyos, so there is easy fatigue and painful joints and all these symptoms. Now, the sources of depression can be for the healthcare worker, it is the fear of being infected or infecting others. Now, she mentioned about resiliency. Now, being resilient is when it is that ability to bounce back, the ability to recover or adjust to a certain misfortune. Okay, so tayo daw, we should enhance our resiliency. How do we enhance, what are the factors that enhance resiliency? So, ang sabi ni Sandy, number one is your health. So, dapat daw lahat tayo may sleep hygiene. So, there are, you have to sleep like 7 to 8 hours a day. Ako, ano yan, offense ko yan kasi I sleep less than 7 to 8 hours. So, you should do aerobic exercises. Yon, importante din yon. And sinabi niya, mindfulness. What is mindfulness? That means that you are attuned to the moment. Okay, so there are 5 things daw for mindfulness. 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Okay, so these are the concepts in mindfulness. Now, there is also what we call emotional suppression. Yung what you are doing is not what you feel you should be doing. Okay, so dapat daw tayo, we should express how we feel. For example, you do not agree to what the nurses, or for example, you do not agree to what the doctor has advised your admitting physician, you should talk to them and say, Doc, bakit kaya ganito ang ating ginawa? So, you have to express your feelings. So, ang sinasabi din niya, yung emotional regulation. You should verbally share your thoughts and feelings. I think that is a very important message kasi when you keep it yourself, the more it becomes a big, big problem. Another concept is social connection. So how do you do that? You express gratitude, you show your appreciation, share with your family and friends what you are feeling. Now, we should also have the help-seeking behavior. Given a psychological problem, it is easier daw to help others than yourself. Hindi dapat ganon. We should help ourselves first. Okay? So, when does a person ask for help? When should you ask for help? When first you are struggling to cope, when the stress gets in the way of your work, or you are thinking of self-harm. Okay? So, yun nga yung mga may suicidal thoughts, no? Or previously, you had a mental health issue and presently, the mental health issue came back or it is in a different form. Okay, so marami tayong natutunan kay Sandy and I suggest you go back to the recording because it will be all on FB Live. And now let's go to the talk of Dr. Blesile Mantaring. Listening to her talk, I really appreciate the work of the Office of Student Affairs. Ang dami nilang programs, and it is all directed for student welfare. So I hope our students appreciate this, no? So yung sinasabi niyang tiered psychological concept, yung first, yung pinaka-base ng pyramid is to promote mental health. And then, yung second, yung targeted, is to prevent depression and anxiety. And third, yung intensive, yun nga yung nire-refer sa psychologist or sa psychiatrist. Now, meron din siyang sinasabi na scoring for patient health quality, yung sinasabi niya na depende kung ano yung symptom, doon natin i-refer. So for example, kung mild symptom, ang sa student, i-refer muna sa psychologist or doon sa mga student volunteers. Okay? And as you go deeper and deeper, then you refer to the psychiatrist. Now in UP, in the student affairs, they have counseling. Okay, so counseling can be done by email, and they have the Lift Up app. It is a mobile app, and where there is open discussion of certain issues. Now they also have audio and video call, and you have the mobile phone for direct communication. And for the first year students, they have the online mental health survey. And in this survey, the first year student is asked, they classify if they use the DAS-21 or DASS-21, which stands for Depression, Anxiety, and Stress Scale. So in this, they now know the category of the patient, and there is an action for each of these students. And they also have the brief resilience scale. So there are many tools that they use. and also the use of the BESS. BESS stands for Bayanihan Employee Symptoms Tracking na system. So both physical and psychological issues are addressed in this BESS. Okay, so I think that is all for this today's webinar. I hope you all go back to the recording and so you can learn more from it. Thank you very much.
Thank you very much. That's Dr. Stella Legazpi Jose, who's the Deputy Director of the Philippine General Hospital. And I just wanted to thank our participants, no. Si Renato Josef may sinabi dito na kasi sometimes wanna pick up what our participants are saying. Sabi niya, integrating spirituality in handling the psychological issues of the pandemic is vital. Nice, no? So thank you, Renato, tsaka thank you dun sa DPI. Ano nga ba yung DPI?
Dots per linear inch. Per inch.
Dots per inch. Okay, thank you very much. All right, next week, we have a very nice topic again, no? So we're going to talk about, safe na ba lumabas ang mga senior na hindi bakunado? Alam mo, pinoproblema namin to dito na marami pa rin senior ay magpabakuna. So ngayon question is, safe ba lumabas ang mga senior na hindi bakunado? So we're gonna have, of course, Shelly De La Vega, who's one of your favorites. And we're gonna have the Philippine Society of Geriatrics and Gerontology. So join us next week. This is going to be another very interesting and very informative session. Over to you, Raymond.
Thank you, Dr. Susie, and thank you for the synthesis and closing remarks from the Deputy Director for Health Operations at the Philippine General Hospital, Dr. Stella Legazpi Jose. Before we conclude our program, let us first acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out our quality content week in and week out. At finally po, meron po tayong channel, as mentioned po, no, all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel. Just type in youtube.com/TVUPPH and you'll be able to see all 90 webinars, and then pagkatapos po nito, 91 webinars na po. And mapapansin nyo po, talagang mental health po as a topic, talagang marami po talaga interesado, and hopefully we'll be able to put out more webinars on the same topic in the future po. So this formally closes our webinar for this week. Next week po, lalo na po doon sa ating mga seniors, sana po ay mas makanood po sila ng episode po natin next week dahil para po sa kanila po iyon. We will, as mentioned by Dr. Susie, will be having geriatricians and also experts from the Institute of Aging. We'll also be having one expert po from vaccine expert panel. So please stay tuned. We are showing on the screen the results po of our evaluation poll with more than 90% po and inconsistent po with our previous webinars, choosing the strongly agree for each of the 5 questions. So maraming salamat po sa inyong lahat. We hope to be able to see you again next week from 12 noon to 2 p.m. every Friday. It's a date.
Together we can stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others laugh before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others laughs before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, pushing on despite the tears. Please take us through another day. Just hold my hand, I will hold the line. I will hold